First at 5, whooping cough is making a comeback around the country, and public health officials in Northern California are on alert.
Yeah, ABC 10's Luke Clary is live in the studio tonight with more.
Chris, Laura, the Centers for Disease Control reports 590 cases of whooping cough in California so far this year. That's more than we saw in all of 2024. So I talked to Dr. Dean Blumberg at UC Davis's Children's Hospital.
Whooping cough cases are running at about twice the rate of last year in California, according to Dr. Dean Blumberg at UC Davis Children's Hospital.
So what is it that's going on right now that we're seeing such a spike in cases around the country and here in the state of California?
We're certainly seeing more cases in California. Part of this is probably related to a hangover from COVID, from all the lockdowns, which really affected transmission of a lot of community-associated diseases. And then we had a buildup of susceptible people.
Infants are particularly vulnerable to the bacterial infection, also known as pertussis.
Why is it so dangerous?
For the youngest infants with severe disease, they may keep coughing until they stop breathing. So they may need to be in the hospital, in the ICU, and monitored, sometimes on a respirator.
The Sacramento County Public Health Department reports more than 70 cases so far this year in the county, more than all of 2024. And on the UC Davis campus, Yolo County health officials reported 4 cases of whooping cough among college students.
So this raises a question, I think, in a lot of people's minds. Are college students at risk as well?
Yeah, college students are at risk because generally the last time that they're going to have been vaccinated for whooping cough would be at 11 to 12 years of age. And then the vaccine-induced immunity only lasts about 3 to 5 years, so it wears off, and then they're susceptible again.
Vaccination is key, Dr. Blumberg says, to protecting both adults and children.
For those who are most vulnerable to severe disease, those who are around infants or have infants, that they're the ones really we want to make sure that they're up to date with their vaccinations, that they're protected, that they don't then increase the risk of transmission to those young infants, and make sure your young infants are up to date with their routine vaccines.
And speaking of vaccines, whooping cough is covered by the Tdap vaccine. The P in Tdap stands for pertussis. We have our entire interview with Dr. Blumberg on the ABC 10 Plus streaming app. Laura?